Currently, at least 200,000 people worldwide are waiting for a life-saving kidney transplant. And according to the World Health Organization, annually only about a quarter of them receive a donor organ. But even after transplantation, complications like delayed graft function, DGF, happen regularly.
Delayed graft function is one of the most frequent complications of transplantation. I would say between 20 to 60%, depending upon the type of donor. And that's a problem because a patient needs to remain on dialysis, and delayed graft function has a negative impact on the long-term survival of the kidney.
Especially organs of deceased donors are prone to delayed graft function, which is an inflammation when blood supply returns to tissues after a period of ischemia or lack of blood supply to an organ. It can even lead to acute rejection or organ failure. Now, researchers and medical scientists from the European consortium MABSOT, or Monoclonal Antibody Solid Organ Transplantation, have tested a new molecule called OPN305 in the clinic to reduce inflammation of the donor organ after transplantation.
OPN305 is actually a humanized protein, an IgG4 protein, which is directly active against a receptor, another protein within the graft, which is called the TLR-receptor 2, and this is one of the key molecules which actually is involved in that inflammatory response.
Gerda Kesters took part in the first clinical trial with OPN305. 2 months ago, she got an injection with the new drug, shortly before renal transplantation.
It's just a completely new life. I'm going to celebrate my 2nd birthday this year.
Before the transplantation, Mrs. Kesters had to go to the dialysis centre 3 times a week for 4 hours and had to follow a strict diet.
It started with completely not eating any salt because of the blood pressure, no raw vegetables and also no fruit because of potassium and the phosphor.
If the kidneys fail to work, water-soluble waste products are not disintegrated, they accumulate and lead to toxication of the body. For these patients, a donor organ is the only possible cure. The new drug, OPN305, was developed by Opsona Theurapeutics in Dublin. Mary Riley is the project coordinator of the MABSOT consortium.
Particularly in the US, there's about 45% of ECD kidneys currently discarded because they're not of the appropriate quality to be used in transplantation. So what we're trying to do with 305 is 1, prevent delayed graft function, and 2, hopefully reduce the number of discards and actually make more kidneys available.
If the study is successful, in future the new therapy could not only be used in renal treatment but also in heart, lung or other solid organ transplantation.